Hello, dear aquarist. And today, for those that keep koi in the pond, I don't have that often the opportunity to show you a video on koi, but I have some. Check my uh, playlist on goldfish and koi. I have once in a while a koi examination I'll do as a fish pathobiologist. It's not so often in comparison to the special veterinarians that work with koi. And there are quite some good veterinarians who take care of koi diseases, visiting the ponds, visiting the koi hobbyists and helping them out and using their tools, taking samples for the laboratory, using a microscope, many things. But sometimes I get koi to see during my work at an importer to finding out or helping out the cases of diseases they're dealing with. And today it's about a koi with, uh, well, so-called koi sleeping disease. Typical something that happens in springtime when the fish coming in into the farm. And that koi sleeping disease called KSD is usually caused by a viral infection called Carp edema virus, CEV. And share you my findings. I share you the koi carp, how they look like in the pond or in the tank. My books explain also about goldfish and koi diseases. Yes, I put special attention to that, particularly in my big book, the new illustrated guide. There is quite some details on important diseases of koi and goldfish. That might help you to understand why do they get sick, how to diagnose, and what kind of treatments you can apply. Here we see the koi in the tank, and some of the koi, the picture will get better. Some are here, like this one on the side, are slow behaving, not normal behaving. And that is a sign that you observe that these fish don't come at the surface for food like a healthy koi will do. And many of the different kois will show it in certain conditions in that slow modus. And that for up to you as a hobbyist, a fish hobbyist, is for you to see and act on time. But the sooner you can act, you better you can help the fish. I will talk about later on what you can do about this koi sleeping disease. Here we see one of those koi. Look at that behavior, that slow motion of the fish, sometimes sleeping, not behaving at all. But you see his behavior is abnormal. And that fish gives you a signal, please help me, check me out. So, as usual, we checked the gills and we found big parts of the gills that completely were white, pale, losing lamellae, having no active function. So, somewhere the gills were badly affected by the virus, maybe. Well, we'll talk about it later. But the gills, and look how reddish they are here. So, the fish had a respiratory problem. When we checked the fish from outside, we could see here some red spot here in the pectoral fin. We could see a red anus. Well, those are usually symptoms of bacterial or viral infection internally. This is something you have to watch for when you see those red bleeding spots on the fish. And when we opened the fish, we saw the bloody organs. Look how big red is here, the spleen is here, how reddish the intestine is, how enlarged the kidney is, even coming above the swim bladder or in between the swim bladder. So enlarged organs. We put samples of the organs for microscopic examination, like the kidney, the spleen, another part of the kidney, and the liver. That's usually what we take out. And, well, the name is wrong. It's not blood parrot, it's a koi. We saw those bad organs. Look how bad all the organs, the liver look, the kidney looks like, the spleen look like. The intestine look like blood parrot is from my previous slide. It's the koi. Bad organs, bad spleen. Look at a reddish intestine. So to give you some idea about the koi sleeping disease, it's also referred as the koi sleeping syndrome. Why? Because it's not always a typical disease sign. It affects koi and carps. It's caused by a virus, usually edema virus of carp, which is a pox virus. Causes also sleeping sickness because the typical lethargic behavior, like I showed you the video. So the key factors or symptoms are they are lethargic, motionless on the bottom, like they are sleeping. Buoyancy, a balanced behavior, I showed you in the video. Reducing feeding behavior, can become skinny over the time. In severe cases, the gills may appear pale. Respiratory, well, I show you the pale gills, so it's some idea what I found is typical for the symptom. The causes are this carp edema virus, which thrives in specific environmental conditions, particularly when the temperatures are between 15 and 25 degrees Celsius. Well, this happens in springtime when the fish come out of 8 degrees water, 10 degrees water, and slowly the water gets warmer. Above 15 degrees, the fish can start to show this viral infection, or they get this viral infection depending on the temperature range. Or when they come from a supplier which was keeping the fish at 10 degrees and you get them in and put them in a water of 18 degrees in your facility. Also, the reason is stressful conditions, poor water quality, overcrowding, sudden temperature fluctuations that can exacerbate the disease. And I know these koi were kept in overcrowding conditions at the supplier for a certain time. The transmission usually is contact with infected fish or contaminated water. Also can be introduced by nets or other equipment or objects that can be in contact with infected fish. So use biosecurity. One group of fish from the same pond in the same tank with their net and their equipment. Don't mix it. Use biosecure rules. The diagnosis is usually done by a laboratory that can find out if it's a virus. The symptoms are not definitive, or other diseases can cause a similar lethargic behavior. So the microscopic examination of the gill tissue, like I showed you, the pale gills, or the PCR testing can confirm the presence of this viral infection. The treatment, unfortunately, you cannot kill a virus. You have to work on good care and improving the conditions. One thing that can help is increasing the temperature gradually within the safe limits of the koi, and that can help to boost the immune system. So raise it above 25. Like I said, this viral infection usually appears between 15 and 25 degrees. Provide a good, high quality nutrition for koi. Foods with immunostimulating additives, also like vitamin C, can help in recovery because the fish have to recover themselves. You cannot kill the virus. You can slow down the growth of the virus in higher temperature or in lower temperature. But because most of the people keep their pond fish outside, and in Western world or in Eastern world with warmer regions, 25 degrees is better to put them at 25 degrees and give them a good food. We can recommend, for instance, Dr. Bassleer Fish Food Forte. That can help your koi. The prevention, first of all, quarantine the new fish before introducing to your pond or mix it with other fish. Optimal water quality and stable temperatures. Avoid overcrowding and minimize stress. It can be devastating, this koi sleeping disease, particularly in high stocking conditions and in poor conditions. So let me go back and show you the koi, typical behavior of that koi. slowly, listless, sleeping disease. And then I show you, like I explained, the gills. Look, the pale gills, like a loss of lamellae. So, my books on fish diseases also talk about koi and goldfish. Try to get them to learn more. Or go to my Patreon channel if you want to become more expert in fish care, fish disease diagnosis, etc. Many opportunities for you to learn. So I hope this special video on koi sleeping disease helped you to understand what you can deal with, particularly now when springtime comes and the temperatures can have an impact. Learn, think holistic, the origin, the cause, and how you can proper care about the fish with temperature and good food. That can help. Thank you for watching.